All right, I think we're good. All right, can everyone hear me? You guys good? Okay, good morning. My name is Dr. Tran, and this is my usual Thursday round. Today we'll talk about nutrition and a career in nutrition. And I have no disclosure, so I'm going to show you guys my share screen. I don't know if you see this. Can you see my screen? Yes or
Yeah, I
no?
can see you. Yes.
Yes? Okay. All right. So we will talk about the career in nutrition and why nutrition is needed for doctor or medical student. All right. Well, so what are nutritionists or dietitian? Those two terms that usually use interchangeable, and a lot of people they confuse between those two terms. So I like to tell you guys really distinguish between the two. And give me 1 second. Let me put this one on Facebook so people can watch what we're doing here. So a nutritionist or a dietitian, basically, they are healthcare professional, but they specifically advise and consult in food selection. And this is the key term because they can diagnose, but they have to work with a doctor to make a diagnosis. Give me just 1 second to post this link online because I just got a message that people would like to see. Meanwhile, any questions so far, guys? Just raise your hand and I will answer your question. You don't have to wait until the last minute. You can raise your hand anytime and I try to address your question as we move along. All right. All right, so moving forward. Now, their duties are varied and depend on their job. For example, dietitians and nutritionists, they can develop nutritional program for hospital patients, advise client on losing weight, or work in a fitness facility, and even with sport team. So in short, their duties vary. They can do a lot of things, and it's amazing how many things they can do or accomplish, and they don't just focus on the food itself. Now, as I said earlier, one of the key things is there's a major difference between a dietitian and a nutritionist. I don't know if you know this in Vietnam, in the US, even in the UK, dietitians are professional, well-trained, and they have to pass a state board exam. So dietitian, they have more education and more thing to follow. Versus nutrition, nutrition have lesser educations, but they have a broader field of practice. So by definition, you guys are nutritionists. Okay, that's it. If you're a doctor, you are a nutritionist. Period. Because you are well trained enough to talk about nutrition. Believe it or not, your nutritional knowledge is better than an average person. Well, I'm not saying you're the expert, but you are better than the average person. So you can claim yourself as a nutritionist. Does that make sense? Okay, so moving on. How much they make? A nutritionist in the US make about $50,000 a year. Just to give you a comparison, the average American salary is about 55,000. So you make an average. The top 10% they can make more. So RD or RDN, they may work in hospital, nursing, public health, home health agents, corporate cafeteria. A lot of options they can work. If you like fat face action trauma, believe it or not, trauma care or emergency is where you can work as a dietitian. Why? Because when people injury and they go into emergency or even ICU, 48 hours, remember 24 to 48 hours after they admitted, they need nutrition. Believe it or not, because if you are in trauma, if you injury, you need nutrition. And this is the key word. If you are a medical student, you have to think about your patient diet and nutrition as soon as they get admitted to the hospital. Does that make sense? You don't have to wait until they get discharged, because this is a very wrong concept. Multiple studies have shown that if you take care of nutrition when they first came to the hospital, your patient doing much better. How about community? Obviously, you work on nursing home, you work with healthcare insurance, you work with a lot of things. And then the last, you work with sport team. Okay, for example, if you love soccer and you would like to work for the national U23 soccer team in Vietnam, and you want to meet with your favorite Thai or whatever, Thủ Môn, so those are the guys that you really want to work with. Yes, you can become a dietitian or nutritionist and you can work with them. And how about adult, elderly, in a setting that we have over time? So those are the long-term care facility. And if you're a nutritionist, you can work in those things. And this is funny. If you love kids, you love infant, this is a perfect career for you. Because infant or a child needs a lot of nutritional support. And this is where you can make a major impact on how to keep a child grow normally. Well, so bottom line, registered dietitian and nutritionist, they assess the nutritional need for both sick and healthy people, and then develop an individual plan of care to improve our mental health. So that's the key thing. They work closely with doctor. They're not doctor, okay? Nutritionist or dietitian are not doctor, but they work closely with us, and they develop an individualized plan for patient. And they use multiple things that just like we do. They use computer software, they do nutritional analysis, and they do EMR. So sometimes they often recommend what we call therapeutic diet. So this is the term that a lot of people confuse, because therapeutic diet, basically a diet can treat disease. But they have to work with a doctor. For example, in celiac disease or in people that malnutrition, the nutritionist or dietitian can recommend a diet, but it has to be in conjunction with the doctor. So this is the law in the US. If it's just a dietitian or nutrition, you cannot treat the patient. So that's the key thing. You cannot diagnose or treat the patient if you're not a doctor. So this is some of the diet that we see as a therapeutic diet. Some gluten-free, some renal diet, some diabetic diets, and some cancer diets. And if you learn more about cancer, you realize that patient, especially cancer patient, they will need a special diet. And don't think about cancer patient like they have to fasting, they don't have to. Yes, they can eat normal food. However, you have to pay some attention depending on what type of cancer or what stage of cancer they are. If they have radiation, if they have surgically removed part of their colon, then you will have a different. Okay, so let me stop right here and take a question, and we'll talk about educational requirement, how to become a dietitian or nutritionist. Any questions so far, guys? If you have any questions, just raise your hand, and we we'll take question. I'll take question, and then we go from there. No question? All right, good. Oh, actually, go ahead, Tú. Yes, Dr. Tú Trinh.
Yes. Yeah, thank you for your lecture up to now. And I have a small questions regarding to the health coach in the fitness center. So as you know, on Facebook, there are lots of health coach, and they also provide the educational program or the diet regarding to the diet for the Facebook users. So I wonder if they are the dietitian, or I wonder if they are just only the nutritionists, or like they just some people who can study online about nutrition and make themselves the health coach. Yeah, so that's my questions.
Great question, Abdul. Myself, I go to the gym quite often, and I have the same question too. So one day, I figured out that actually they are nutritionists, and they just like people. I told you they have a plan for everyone. For example, the one I'm going to, it's called Planet Fitness, and they have a nutritionist put in recommendation for a diet for this particular group of people. And I think it's fine. If you look at that, you find it interesting that, for example, if you are overweight and you try to lose weight, they have recommend specific diet. If you are just like me and I like to gain some muscle, they recommend a little bit diet. Basically, focus on more on protein and just gain muscle. Okay, let me answer this question real quick. Okay, any other question before we go back to go ahead, Hannah. So Hannah raised hand, and let me give Hannah the microphone. Hannah, can you hear me? Where is that? Okay, Hannah, go ahead. Well, I cannot hear you, Hannah. All right, let me keep going and yeah.
Yeah. Now I'm student. Yes.
Hannah, can you?
And now I'm training by nutritionist, and I want to see in UK or US.
Okay, can you repeat your question again? I have lost your question at the beginning. What is it? Okay, let's go back to you later, Anna. And okay, so let me go ahead and continue with this presentation. All right, guys. Now, we see a number of questions how to become a nutritionist or a dietitian. So the minimum requirement for both of them are a bachelor degrees. So in the US, you will go to a 4-year school to become a dietitian and a nutritionist. And you will, yes. Now, generally speaking, for a nutritionist, you don't have to take a board exam, but for a dietitian, you have to take a board exam to become a certified dietitian. Now, most people today, they offer master, or most schools today, they offer master level. So less and less have a bachelor. Well, in order for you to become a dietitian, you have to do 12 hours of supervised, basically they do an internship. Now, just to give you an idea, 12 hours is how many hours a doctor have about 50, I don't know, 1,000 hours. So 1,200 hours, 40 hours a week. So you do a month, 120. So you do 10 months, basically a year of internship. Okay, and then the last one is they have to pass a board exam, become a certified dietitian. Now the job market for a dietitian, or so you know what, would you mind just let me mute all of you, because it's very distractive to come here and not mute. Okay, let me go back here. All right, the job market is good. All right, so thank you for the Google image, and then I have some information here from the West New York Dietetic Association. Now, moving to you guys. So why doctors should learn nutrition? The absolute answer is yes, you must learn nutrition. In my round with my medical student, intern, residents, I would almost have one question about nutrition for my residents. Why? Because if you don't know about nutrition, you suck and you will not take care of your patient well. Here's the reason why. Number one, food is medicine. You are by what you eat. You know that, right? But this, I like to re-emphasize again, as a doctor, food is medicine. Whether you want or not, it's type of medicine. Out there, people take all type of herbals. Yes, it will impact to your medication. It will have interaction with your starting or whatever medication you would like to give your patient. Now, long-term and short-term effect depends on food. And then it involved with every specialty. Well, you say you're a neurosurgeon, you don't care. Yes, you do care. If you say you are a, let's say, plastic surgeon, yes, it's still involved. And obviously, if you're internist, if you're dermatologist, you are gastroenterologist, everything, every specialty involved with nutrition, okay? And then, of course, does it bring a better patient and doctor relationship? For sure, patient will like you. Now, how do you learn? So nutritional teaching is minimal in medical school and residency training. Even in the US, we receive very little, very little in my medical school and also in my residency and also in fellowship. So I love nutrition. So that, I learned this for myself, and I'm a member of a couple of nutritional organizations. Okay, how to learn? Self-learning is the key, because if you don't learn by yourself, nobody will teach you. So today you come to this meeting with me. I just want to give you an idea that yes, you can become a nutritionist. Yes, you can become a nutritionist, okay? Because you know the basic already. As a medical student or a doctor, you're way above the average. You know a lot about biochemistry. You know a lot about anatomy. So the only thing you need to do is brush up your skill and keep up with what's new out there. So how do you learn? Online versus offline. And there's one website I strongly recommend you to go to today. Okay, and I will show you at the end. Now, the next one is when you do online. So if you're in Vietnam, and this is the thing, if you're in Vietnam and you would like to become a nutritionist in the US, the answer is yes. You can register online and you can learn from major university. And I share you two schools here that I found. Number one is Central Michigan University Global Campus. You can earn a Master of Nutrition in Master of Science in Nutrition and Dietetic Science. And it costs about, this is 30 credit, so about 600. So this is about 20,000 for the master degree. And the other one is University of Massachusetts at Amherst. This is a really good school. And they also offer the online nutritional program. So that hopefully that will give you, now the last one is when you take school online, you wonder, are they able to give you state for state licensure? And the two schools I just give you will for sure put you able to take a licensure exam. And then the last one is, are they associated with medical school or hospital? Because often they will give a better trainings. All right, so let me stop right here and I will share you guys a couple more resources, but let me take some questions before I show you a website that everyone should learn or should know about. Any questions so far, guys? Okay, go ahead, Kim. Kim, go ahead.
Yes. Hello, everyone. Nice to see you again. I'm sorry because I came a little bit later after your starting the presentation, so I didn't follow all of your presentation. And I had a question concerning about how to distinguish the treatment, nutritional treatment task between the nutritionist, a dietitian, and a medical doctor specialized in nutrition, because as my knowledge, when you have a nutritional intervention on the patient, it would be distinguished about the general information intervention and the customized diet intervention. For example, if a patient has some problem with the normal diet, we as a doctor, we maybe sometimes have to intervene to the nutritional status by a very special treatment. For example, that patient is very weak and they cannot eat by themselves. So we have to indicate that we need a feeding by nasogastric tube or the parenteral intervention. For example, the IV infusion of the special fluids, for example, the lipid or protein by the intravenous vein. So who is the patient who indicate this indication? A dietitian can have the special treatment, can give the special treatment to the patient. For example, if the patient cannot eat, can the dietitian can prescribe a parenteral feedings, or just a doctor, a medical doctor like this? Because as I know, in Vietnam, there's only the medical doctors can indicate that whether the patient need a enteric or parenteral intervention treatment. And that is my question. How about the US system?
Thank you, Kim, for that very practical question. In the US, you will need a doctor order in order to do so. So this is how it works. When I work in ICU setting, the nutritionist or in the hospital, a lot of them are dietitian, not nutritionists. So they have a higher level of education. They put in recommendations. And usually they talk to you, hey, Dr. Kim Win, I think this patient needs NG tube, and you need this certain amount, like 1.5 per the 1.5 type of protein, and then such and such per hours, and it start with a bolus, and then it's very similar like an IV medication. So they give you a very detailed, and then you are the one that put in the order. So not the dietitian, because they cannot sign a medical order, but you work very closely with a dietitian. And the future of medicine in the US and in general, we're a collaborative team. Nobody know everything, but because we learn from each other better if we work together. So that's how the environment at the moment. All right, guys, any other question before I show you guys the last slide? And I like to know if you ever know about this website. So there's a website, it's called Nutrition in Medicine, and developed by the University of North Carolina. And let me show you a couple things. In this website, I also participate in, let me find, where's my screen here? Yes. All right, so this is here. So can you guys see it? It's called Nutrition in Medicine, right? So www.nutritioninmedicine.org. This website developed by the University of North Carolina, and it's a really good website. Why? Because look at the member team. They are professional, and they are so there's a doctor here, and dietitian here, and there's nutritionist, and there's a doctor. But the bottom line is, you go to this website, okay, and this I'll show you how to do it. You have to register, but it's free. So go to home and you go continue to courses, and then you need a Chrome setting, but this is easy, just setting this, and then you should see all the information. They have a lot of module online that I showed you earlier. So they have module for kids, module for elderly, module for almost everyone. It's amazing that how much you can learn this, and it's free, and it's from a medical school. So think about it. If you were a medical student in Vietnam, this is your best resource. It's free, and it's from a reputable medical school in the US, and that's it. So I learned a lot from this website, and I am also one of the member there as an instructor. So I would love to hear more from you guys. All right, so I think my presentation is up right here, and let me pick up some of my students here. Okay, who would like to go first with questions? Nobody? All right, let's see. All right, Ngân. Right here, and let me pick up some of my students here. Hello, Ngân. Okay, there's two hands. Okay, Kim, go ahead, Kim.
Yes, I'm sorry. I had another question about the distinguished about the nutritional care system in the U.S. and what is the different things between the U.S. system and Vietnamese system, because as I know in Vietnam, there's only one system that a caregiver must be a medical doctor before specialize in the nutrition. So everything seem to be very simple as the system, because all of them are doctors.
Mm-hmm.
And there only one thing to distinguish is to categorize it the general nutrition and the clinical nutrition. As me, I work at the clinical doctor, so I'm specialized in the clinical nutrition. That means I customize my treatment to the very personal patients and very detailed patient. It's different from the other dietitian or the doctor that they give the general information about nutrition, for example, for the healthy people, not for just only the ill people. But what is the difference between a dietitian in the US to give the preventive nutritional intervention and the clinical treatment nutrition? What is the difference between
Well, the difference here is, first of all, a dietitian in the US, they're not a doctor. So they is a consultant. So you put this way, they put some recommendations. But you, as a doctor, will make a final say whether you listen or not. It's very common in the US, like, okay, I need consultant. Like if you're President Trump, okay, Kim, and Ngân, Kim Ngân from Cần Thơ is your advisor. So Ngân will say, do not bomb Syria. And then here, Dr. Tu from Korea, she say, yes, Kim, let's just bomb Syria. Or whatever it is, your final decision, you, because you take responsible. But those advisors are like nutritionists or dietitians. Now, however, this is interesting. If you do not follow, if you do not follow their guidelines, you may be in trouble, even though they're not doctor. Why? Because they follow national guideline, and this guideline has been developed in conjunction, so doctor, nutritionists, and we found that, for example, patient with trauma, and they have issue with their nose, so you need to get them NG2 feeding, usually 48 hours, very soon after they've been hospitalized, right? So you do that. So that's the distinguish, because they're not doctor, but they are professional, and usually you as a doctor, you should listen to that. Okay, so go ahead.
Yeah. Hello, everyone. My questions will be a little bit too specific, and actually as I heard from you that the nutrition and dietitian, they will also follow the guideline. So I would like to ask if there is any specific guideline made by the dietitian, because usually I saw the guidelines made by all the specialists, and the nutrition part is a very small part in the guideline. For example, the GINA guideline, they will have a small section regarding to the nutrition in asthma. So that's my first questions. And the second one is about the practical application of the nutrition during your daily treatment for the patients. Like for example, in my field, in the patient with asthma and allergy disease, we found some observational study demonstrating that the low level of vitamin A, C, and D will lead to the more severe asthma or uncontrolled asthma. But honestly, practically, how many percent of the doctors will consider the nutrition in the patient with asthma? So, and I also would like to hear from all the doctors in our table about their experience with the nutrition in the asthma patient, if possible. So, thank you.
Excellent question. So let's go back to your first one about the guideline, a specific guideline. In the US, there are two national organizations, nutritionists versus dietitians. And believe it or not, the nutritional guidelines is one of the ones that has been changed multiple years. I don't know if you remember years ago, there's a diet called Atkins diet, and then it's come to Mediterranean diet. And then another one is with low carb, so high protein. So it's like a fashionable trend, at least in my opinion, because we have so little information about diet outcome. And it's such a complex outcome to measure. I'm sure you know in research, what is primary outcome? And the primary outcome in nutritional intervention is so difficult to measure. It depends on the patient comorbidity, the complexity of the disease, and also age, and also gender. So it actually, there's very few guidelines, and I just go with my guideline from the ACP, which is the American College of Physicians, or the guideline from the national, so GI Society, they do recommend some guideline in celiac disease, and also for endocrinology, the American College of Clinical Endocrinologists, they also have some guideline for diabetes. So I follow with doctor guideline. I don't follow with nutritional or dietitian guideline because it's just my personal view. Okay, and go to your second part. I like to see what other people here share about their experience. But I agree with you. It's very impractical to do that, because if you are a practicing physician, I don't know, in Vietnam, in the US, you're quite busy, and to intervene with, for example, asthma patient, and you give this, it's a challenging task. Even though I think it's possible, but it's quite challenging. All right, so I will give the microphone to the community here. Go ahead, Dr.
Hello.
Yes.
Okay. Hello, everyone. I have one question.
Mm-hmm.
That I know that there are many courses online to learn about nutrition, but they are frequently taught by international teachers from other countries. But the fact that the food in Vietnam is different with the food in the other country. So it's feasible to apply the knowledge from these courses to Vietnam. And the second question is, do you know any reliable website in Vietnam to learn and update information about nutrition?
Excellent question. I like this question. Thank you very much, Dr. And by the way, are you a student or are you a doctor?
I'm a student.
Very good. And I like to see more students like this. You know why? Because as Asians, our diets is different than Americans or Caucasians. So you bring up a really good point that whatever you learn online there is applicable to or to your patient in Vietnam? And the answer is it's up to you, because you know some nutrition already, and then you have to find yourself about how to apply that knowledge to a daily menus in Vietnam. For example, this is how I would do. If you look at the carbohydrate, protein, vegetable, fibers, calories in a hamburger, right? And you learn online, and you try to convert that into a normal cái dĩa cơm in Vietnam. And that's how you will tell your patient, because carbohydrates a little bit more compared to that, and now sugar and vegetable. But the bottom line is, you can, interesting enough, you can make a conversion, and you can apply that to your patient. Now, the second part of your question, do I know a reliable source in Vietnam? No, I don't. But I think some of you here will, because as I say, most of my guidelines from the US. So I don't know if anyone here can give on a good website in Vietnam, nutrition in Vietnamese. I don't know. But if you ask me in English, yes, I can find. Anyone? Just raise your hand. Go ahead, Tim.
Everybody, sorry because I don't know raise my hand on the Zoom. I would like to ask you one question. Does it an original guideline in USA? It means the website which you introduce. Is it does it an original guideline in healthcare system in USA?
Yes. So the website I introduced you guys is called Nutrition in Medicine. This guideline actually was developed from faculty from the School of Medicine, University of North Carolina. So this is a reputable US medical school. So the answer is yes. And they can give you some really good idea how to, they're not truly a guideline, but many modules that you will learn about how to access nutrition. So take a look at the website, and it's free. So go ahead. Kim? Go ahead, Kim.
Yes, I would like to add more information about the websites and many source of information in Vietnam, because sometimes I work with the doctors specialized in nutrition in Ho Chi Minh cities, and I would like to introduce some more source of information for the student. And firstly, we have a society for nutrition in Ho Chi Minh City called HOSPEN. HOSPEN means Ho Chi Minh City Society for Clinical Nutrition. And I don't know whether they have a official website, but they officially organize many seminars focused on clinical nutrition, and they publish their information widely into the internet, and you can join online or offline seminars. And about the website, I think there are many websites in Vietnam who supply the very credible information about nutrition, general nutrition and clinical nutrition also. For example, the National Institute of Clinical Nutrition in Vietnam, in Hanoi, or the Department of Nutrition of the medical school, for example, the Ho Chi Minh City University of Medicine and Pharmacy, Ho Chi Minh City. They have also the website, and sometimes they have the seminars, and the CME seminars are focused on the nutrition. And another website is the website of the Ho Chi Minh City Institute of Nutrition. You can search in Vietnamese, Viện Dinh dưỡng, or Trung tâm dinh dưỡng, Nutritional Center in Ho Chi Minh City, and they also supply the very credible information on nutrition. And you can also have some seminars organized in Vietnam by the international organization. For example, the very famous foreign organization that worked on Vietnam is ESPAN. ESPAN is European Society for Clinical Nutrition, and currently ESPAN and HostSpan, they very strictly cooperated, and annually they have many courses, offline courses in Vietnam. And as we are surgeons and we are operating a fan page on Facebook about the surgeon. That is the fan page of Department of Surgery in the University of Medicine and Pharmacy, Ho Chi Minh City. And we also give some news and information about the nutritional courses if they organize. So please refer to this website for your more detailed information. So that's all.
Right. Well, thank you very much, Kim. Those are really good information. So let me go back to my student here. None. Okay. So first of all, what you guys, from your medical student perspective, think about nutrition?
Sorry.
What do you think about nutrition?
I think that is a very special, very into about
Speak louder.
science.
Speak louder.
I think that is very special in medicine, and I'm very into nutrition and nutrition science, and I hope it is more invasive, pervasive in medicine.
All right. So next time when you guys talk, I will join you guys and I will test you about nutrition, okay? Because as I say, I like to focus more on teaching medical students about nutrition. And nutrition, let's make it fun because nutrition can make people beautiful. Okay, if you bring this to like a movie star and say yes, and they do a much better job than us, because actually that's how we or you guys and medical students should focus on is how nutrition can impact their daily life. Okay, and for all the students right there out there, the number one thing for you to do internet and for nutrition is eat on time. Okay, don't skip breakfast. Don't eat late because you will have stomach, you have acid reflux. Many of my students have GERD, and because of you guys stay up late, you eat noodles and mì gói, beer, whatever, and then you have a very poor nutritional status. Okay. Any other thing before I am going to close my conference in 4 minutes? Let's see, Tu. Khatu, can you hear me? Hello, Tu?
Yeah, I can hear you.
Okay, so how's everything there?
Oh yeah, I really find the course interesting because I personally have seen a patient who a diabetic patient, and after like she do a lifestyle changing her diet and doing exercise, she got off medication for like for months, and her hemoglobin A1C have been like under the control, and I was very impressed with that she doesn't need medication anymore to control her diabetes. She just simply changed it through changing her lifestyle. And that's it a change. I think that is a trend in medicine right now that we focus on more well-rounded aspect with cooperation between lifestyle changing and medication to have the patient control the chronic disease. So actually very interesting in that.
Yes, diabetic patient, and this is for all of you out there, students. If you can ask your patient change your diet, no, not their diet, you will cure. I would say you will cure the diabetes. Okay, just like Katus.
Yes. I have a little small question though, because when I go on the website Nutrition and Medicine that you bought online yesterday, they ask for the access code.
You don't need access code. You don't need access code for instructor only. So you can register and you just go to the course. So as a student, you have access to 90% or 80% of the content on this website.
Yeah. Yesterday I registered a student, and they say the student who interested in the course should contact with the instructor who can arrange the detail with them. And I don't know. I contacted my dean already, but I haven't heard from him. But as of now, like I cannot get into the course. I don't know why. I will look at it later. But been sometime yesterday I could not get into.
Yeah. So here's what I do, guys. I will go to the website and I log in next time with you guys, so you can see under my screen, and I will walk you through my module. In fact, what we can do is, if we have nothing to do on Thursday round, I will teach you guys based on the module. Okay.
Okay.
So
Thank you so
go
much.
on this, and I think it's going to be fun, very fun. About when I learned about breastfeeding, it's amazing. I mean, it's, oh my god, I don't know much about breastfeeding until I look at that and say, really? And you said that, so that's just amazing. So that's a lot of things that we can learn and we can share. And I think nutrition is fun. So let's make it a habit, okay? And I will see you guys more often about this topic. Of course, I see you guys every week, but let's focus more on nutrition and make everyone here a healthy diet every day. Cool. All right, guys. So have a good night wherever you are in Vietnam, and then have a good day in the US. If you have any questions, just follow my Facebook. Post your question there. This is Dr. Tran from VietMD. Thank you.